discussion is on chronic disease management, focusing on diabetes outcomes in the primary care setting. In today's medical environment, failure is not an option with regards to meeting quality metrics. The objective of this talk will be to optimize workflows to achieve outstanding diabetes metrics, and we will be presenting a 4-stage game plan that takes us from the pre-visit to the post-visit follow-up. This schematic diagram illustrates our stages. Stage 1 is scheduling appointments. The PSR, or Patient Services Rep, will discuss with the patient the importance of bringing all medications, bringing labs, as well as any pre-visit labs that will be required. The second step is the Quality tab. The nurse manager will review the QM tab to look to see that all screenings have been done and any outstanding screenings with regards to cancer, osteoporosis screening, depression screening, as well as the annual wellness visit and chronic disease management will be reviewed. The nurse will then begin the game plan, which we will talk about shortly. The game plan then goes to the physician for the physician to enter orders, take notes with regards to medication changes that may be required during the visit, enter procedure orders, as well as to begin considering HCC coding that will be utilized during the office visit. The game plan then goes to the CMA. The certified medical assistant will input the patient into the lab schedule if necessary, prepare for procedures that may be required during the visit, and at this point it's time for the patient to come and the game plan has been distributed to all members of the team. The final stage is the home follow-up. The nurse manager and medical assistant will be responsible for following up with the patient, especially with regards to complex medication regimen, as well as any changes and modifications in behaviors that are needed. So here's the game plan. This is the major portion of the 4-stage workflow. The nurse has reviewed the referrals, screenings, and vaccines that are required, and for each patient that will be seen on that day, there is a listing of everything that is due for that patient. The medical assistance tasks have been entered by the physician, and the patient will possibly actually have the ECG prior to the physician seeing the patient, since we knew that this was something that was needed for the patient. In addition, the patient has been prepared for a foot check and has removed their shoes. The physician's tasks have also been outlined. Coding that may be necessary, such as an annual visit, notes with regards to possible adjustments in medication, HCC codes that discuss the complexity of the patient's visit have also been jotted down in the physician's task column. So the 4-stage workflow is the pre-visit, the chart prep, the visit, and the post-visit. During the pre-visit, the receptionist or PSR will advise patients of the length of the time of their visits and what is needed during that visit. For example, patients with an A1C over 10 may require a 30-minute visit, or patients who are coming in for diabetes and also need an annual wellness visit or physical examination will also have a longer visit. The patient is also advised regarding pre-visit laboratories. The medical assistant will input standing lab orders. This can be done for the entire year. The medical assistant can input quarterly hemoglobin A1C labs as well as an annual microalbumin, and this will reduce the time that the CMA spends conducting pre-visit laboratory assessments for the patient. Next, many systems are at this point require the importation of past results from a previous EHR. This is done at least 24 to 48 hours in advance of the patient's visit. The physician will then approve, review, and sign orders. The chart prep. The physician will look at the last annual visit, past results, the QM tab is perused, input orders, input procedures for the day, as well as to plan medication adjustments as well as coding. The nurse Her primary responsibility is the QM tab, and she will put in orders that are required and combine flow plans between the physician, the nurse, and the CMA. The CMA will schedule the patients, prepare the rooms, and prepare the supplies. At this point, the game plan is complete. Everyone knows the task for their day. During the office visit, the CMA may complete the procedures prior to the physician actually entering the room. The orders have been input, and therefore everything is ready to go for the patient, and there is very little downtime or what we call slack time during the patient visit where they're waiting for the physician to come into the office. The nurse has also discussed the screening referrals. She has administered immunizations such as the pneumococcal vaccine or the influenza vaccine because the orders again have been entered prior to the patient coming into the office. The physician then conducts the office visit, discusses goals, inputs future lab orders if necessary, and schedules future visits. Referrals to behavioral health, podiatry, ophthalmology, certified diabetes educator, and nutrition, and other referrals are then conducted as well. The PSR also knows in advance which referrals will be needed, and additional referrals may have been generated during the visit. She then knows to schedule the lab and the physician visits for the future. In follow-up, the nurse will contact patients 1 to 7 days after the visit. If the patient has been initiated on insulin, the patient will receive a call 1 day after the visit. In addition, the nurse is responsible for managing the QM tab and reviews the QM tab on at least a monthly basis so that she can call patients who are out of compliance with their visits or out of compliance with diabetes measures. This data is also reviewed by the nurse at staff meetings. The CMA will recall patients to return for abnormal results, and the physician will create individual care plans to improve the metrics of the patients. This has been the 4-stage diabetes workflow to improve diabetes metrics because failure is not an option, and we can get to an A+ in the management of diabetes.